We have evaluated the outcome of myeloid malignancies, myelodysplastic with TP53 mutation, and we have found distinction in how these patients behave when they have a chronic disease versus advanced MDS and acute myeloid leukemia. So, among low-risk MDS patients or those patients with chronic myeloproliferative neoplasm, we have seen that the single hit, as per initial data, have a comparable outcome compared to the wild type U3. Whereas when these MPN patients or MDS patients progress or AML patients, we didn't find that distinction that single hit versus multi-hit have any difference in outcome. Having said that, because there are multiple pathways which have been activated when disease evolve with time, when the distinction is less clear compared to when they have an indolent or low-risk disease. Having said that, come to the other point. If you have a low-risk MDS patients or chronic phase myeloproliferative neoplasm with TP53 mutation, usually these patients have a low variant allele frequency, and most often we don't see a complementing complex cytogenetics. So these patients tend to do better. The time interval from diagnosis of chronic phase disease to advanced phase disease is relatively longer than what we expect with a TP53 mutated myeloid neoplasm. When these patients progress, they often have a complex cytogenetics such as MPN with blast phase or myelofibrosis accelerated phase or high-risk MDS with excess blast or AML. Then we don't see the distinction, and at that time, the occurrence of complex cytogenetics is an independent prognostic factor that predicts their outcome in terms of event-free survival and overall survival. In terms of therapy, all compared chemotherapy regimens tends to have a comparable outcome. What we have seen that hypomethylating agent-based combination gives you the best yield in terms of achieving the response rate with minimal toxicity, and among those patients who are eligible, have a donor availability, can proceed to bone marrow transplant to improve their long-term outcome. We have presented data in several cohorts of these patients, those with MPN blast phase, those with acute myeloid leukemia, as well as high-risk MDS patients. Although the proportion of patients going to bone marrow transplant is around 10 to 15%, however, among these patients, you can see a 2 to 3 year survival more than 50%.